guide to self-collection for the anterior nasal swab. The anterior nasal swab can be utilized in numerous settings, but today we're going to discuss how to perform the swab on yourself to get a sample. Remember, the swab is performed in both nostrils. It lasts approximately 10 to 15 seconds in each nostril, and it will be performed at a depth of approximately 1 centimeter. It's important to review manufacturer guidelines because certain manufacturers will require different depths, but 1 centimeter is a good guideline to follow according to the CDC. It's also easiest to perform this swab with a rigid swab so that it doesn't snap or bend when you're performing the swab. And a swab with a larger tip is also preferred to maximize surface area so that you can absorb a better sample. The picture on the right has 3 different locations. There is the NPS, the MTS, and the NS. The NPS stands for the nasopharyngeal swab, which is the depth that the nasopharyngeal swab should go. And you'll see in the middle there is a MTS, which stands for mid-turbinate swab. And then at the front, all the way to the right, there is a bubble with NS, and that stands for nasal swab. And that is the depth and location at which the swab should be performed. If you look at the picture on the left, it shows you that the swab is not going to be inserted very deep. It stays in the anterior nostril, and you're going to circle the anterior nostril when you're performing the swab for 10 to 15 seconds each in both nostrils. The step-by-step process is as follows. Make sure you prepare all the equipment that you need to complete this procedure so that after you perform the swab, you're not going to be chasing down different bits and pieces that is required for you to obtain your sample. Make sure you open and place the swab at least 1 centimeter into the nair, or just until the tip of the swab is not visible from the outside. Again, please refer to your manufacturer guidelines depending on what test you are using. Please remember that you're not going into the nasopharyngeal passageway or going up into the mid-turbinate area. The swab should remain in the anterior nair during the duration of this procedure. Then you swap the nair in a circular motion for 10 to 15 seconds while twisting the swab, and then you'll repeat this process in the other nostril using the same swab. The procedure is then complete, and then you can place the swab in the medium, you'll secure it, and then make sure all your demographics and data are complete so that the results can be linked back to you. There are certain things to keep in mind when performing the anterior nasal swab. If you have a piercing, just skip over the area where the piercing is and continue the swab as instructed in this video. There are some contraindications to this swab, and they are epistaxis, which is a nosebleed, recent surgery, or recent piercing to the nair. If you just had a nosebleed or are currently actively bleeding, do not recommend this swab being performed as you might compromise the sample or make your bleeding worse. If you just had surgery to the anterior portion of the nose, I don't recommend that this swab be performed. However, if you had a procedure such as a deviated septum repair, it is okay to perform this swab as the area of the nose that this swab is being performed in does not affect the surgical site. Additionally, if you just had a piercing, if there is an infection to the piercing site, or you're just having trouble recovering from the piercing, I also don't recommend that this swab be performed as you might risk further infection and irritation to the area. This concludes the guide to self-collection for the anterior nasal swab. Hello, today we will be reviewing the technique for the anterior nasal swab. Please note that anyone performing the swab on a real patient should be utilizing the proper PPE. The swab should be inserted 1 centimeter into the nostril. The cotton tip of the swab is approximately 1 centimeter, and you can insert the swab until the cotton is no longer visible from the outside. Then for 10 to 15 seconds, circle the inside of one nostril with the swab. After 10 seconds, repeat the same procedure with the same swab in the other nostril. Whichever way of holding the swab is comfortable to you is the way that you should hold it. The closer you hold the swab to the tip, the less flexible the swab is, making it easier to maneuver. In this clip, you can see the swab bending because the grip is far from the tip of the swab. Remember that this swab is not invasive and should not be uncomfortable for the patient. Once this is complete, place the swab into the specimen tube until it is just above the media to guarantee that the swab will fit after being snapped. Then use the thumb that is holding the tube to push the swab against the edge of the tube. Use the other hand and hold it on the opposite side close to the two hands that are almost touching. Use a quick, forceful movement to snap the swab. It may take some practice as the swab tends to bend if not done properly. Remember, your specimen tube should be already in the opposite hand that you are swabbing with so that you can easily secure the specimen.